My name is Rachel Sutton. I'm a practical nurse instructor, and this is my 4th year teaching at the college. My favorite thing about being an instructor is getting to constantly learn. I get to learn things not just from the students, but learn things about my courses that I get to then pass on to them. A piece of advice for someone becoming a practical nurse would be you have to be flexible and adaptable and ready to learn new things every day. The facility at Olton's allows for classroom education as well as lab time. Our labs have state-of-the-art mannequins that allow for different procedures to be done, whether it goes into our maternity care, pediatrics, or into our surgical care. And we're hands-on with you the whole way. I got my diploma here at Olton College. I was the first graduating class. I think that it gives me more of an approach with students that I know exactly what they're going through. Have we had anyone afraid of blood or needles? Yes, it's very common for needles, not as common for blood. I think their fear of needles is more about getting them than it is giving them, and we're able to overcome that hurdle. Blood's a tough one, but you'd be surprised what you can get used to. The difference between a registered nurse and a practical nurse is the years of education. One is a diploma program and one is a degree program. I think the greatest thing about the two roles is that we teach you in this program how to work collaboratively together, and the scope of practice is becoming very similar. If you wanted to become a registered nurse later on, this course does allow you to be able to bridge into that program at a later date. After you've completed these 2 years, you can go on to complete the years to become an RN at, right now, is UNB. The amount of theory compared to hands-on is very similar. We teach you in the classroom starting your very first week, and then we start you in the lab that week. So as you learn, you get to practice hands-on as well. What do students overthink? They definitely overthink having to be perfect, and that's not part of being a practical nurse. It's almost more important to give it your all and be a team player and be accountable than it is to have the perfect grades. No employer will ever ask us if you had 100% on everything. They're going to ask us if you showed up on time, and we're excited to learn. The number one question I get from new students would be, what are the different kinds of places that I can work in? And especially now that's varying so much. We have really gone from long-term care into hospital setting, acute care setting, extramural based, foot care. We have some of our graduates working in ICUs, some of them going up to the Northwest Territories. So there's endless opportunities for our grads at this time.